Hello, my name is George Wanamaker. I'm one of the physical therapists at Presbyterian Village, and this is a continuing series of back care and maintenance. What I'd like to talk to you about today is different pain reducing strategies outside of activity and exercises, particularly talking about heat and ice and heat versus ice. Which one is appropriate, which one is not. Maybe both are appropriate. So just going through what the indications are for both, and then talking about some considerations. So let's start with ice first. Um, not one heat versus ice. One is not necessarily worse than the other. They just have different applications, and you have to be aware of what the applications are because you may end up doing more harm than good if applied incorrectly. So let's talk about cold. Cold therapy being an ice pack, a gel pack, even frozen peas. Like that's the old kind of, you get some frozen peas out of the freezer and put it on. Um, you it's important to know exactly what the cold is doing and then why you would want to use it. So you really want to use cold after an initial injury, such as you're out doing something, lifting something, doing something strenuous, and you either hurt yourself or you have a sort of an acute sudden pain. That would be an indication more to use cold. Also, if you've got an inflammatory condition, like a severe arthritis or something like psoriatic arthritis or multiple sclerosis or something like that, you really want to think about reducing the inflammation and reducing any kind of local swelling, just keeping your nervous system and your pain and your muscles calm. So there's some evidence that also cold may have an impact on your immune response. Being short bursts and periods of cold has triggers or elicits an improved immune response temporarily. There's evidence out there that supports that. So a good indication for cold would be you can use it on regular arthritis pain if you've got arthritis in your back, your joints, your knees, that sort of thing. You really want to, if you have swelling, you want to think about using cold versus heat. Cold is definitely, if you've got a lot of swelling, even if you have arthritis and you have a lot of swelling, then you really want to use cold versus heat. Even though the heat may feel good, you want to avoid it because it may trigger more swelling to the area. Ice also has sort of a numbing effect on the nervous system. It can help locally around the area, help reduce the sensitivity and the pain response. See, even though ice can initially elicit a response, it has sort of a numbing effect over time, helping reduce the pain locally. And again, it can help with some local swelling. Some considerations about why you may not want to use ice or how to appropriately use ice. One, if you're sensitive to cold, if you've got skin sensitivity, if you have blood pressure issues, you may want to be cautious about using ice or heat. You just want to be a little more cautious. You also want to make sure that if you're using ice, you apply a towel or a pillowcase or something, a barrier in between that and your skin. So one, you don't irritate or damage the skin. And then about timing, you really want to think about limiting the amount of time that the ice is on, ice or cold or whatever treatment you're doing at home, because limited to about 10 to 15 minutes, because there's a phenomenon called cold-induced vasodilation. And what that means is after a certain period of time at a certain temperature, you can actually cause your blood vessels to dilate and to bring more fluid into the area, which is kind of the opposite effect. Now, the physiology behind that is very complex, but I would say if you're doing any ice for your back at home, limit it to just about 10 to 15 minutes or so. And again, apply a local layer between the ice and your skin, just as a protective layer. Ice is also recommended post-surgery. So you really, if you just had a surgery, really within the first couple of weeks, you do not want to use heat. You want to use any kind of ice or any kind of cool. Heat can bring swelling to the area, can cause for more moisture buildup. And unfortunately, if you have any kind of bacteria, heat can more readily allow that to grow and to proliferate in the area, which you don't want. So we never ever recommend heat to an area that's post-surgical, especially early on. Now, if it's, say, a back surgery or a knee replacement, 6 months to a year down the road, that's a different story. But especially right after a surgery, you want to avoid heat, and you always want to use ice if you're going to use any kind of surface treatment like that. So for heat is really good for any kind of chronic pain, chronic arthritis, any non-inflammatory body pain. Inflammatory meaning that the local area is irritated, the tissues are swelling, the tissues are red. There's a local response there. You want to avoid heat. You would probably rather use ice. Heat is good for muscle soreness. So especially after you've done some activity and you're sore the next day, or you have a delayed onset muscle soreness where you did a lot, and the next day you're just stiff or you're sore. Heat is good for that, for relaxing the muscle tissues. And heat also has a calming effect, and there's a certain neurological response that heat triggers. Again, the physiologic response is very complex to that. So just know that heat has a calming effect on your system. So it's good for stiffness. It's good for delayed onset muscle soreness, any just prolonged muscle soreness, any chronic pain. Heat is good. Heat can also help if you're having any muscle spasms, or what we call trigger points, where there's, if you have a muscle and the muscle has a tight area that's where it's contracted, it may feel like a lump or a hump or something, but that it's clearly the muscle tissue. Heat can help sort of subside and reduce some of that local stiffness and muscle contraction. And again, heat has a calming effect on these tissues in your nervous system. Something you want to monitor for is watching for burning yourself. It does happen, and unfortunately it does happen. So if you're using any kind of heat or ice, you really want to have a layer in between your skin and in between the heat or the ice, just as a protective layer. So the reason I'm talking about this is people commonly use heat and ice for their back, and which one do I do? How often do I do it? That sort of thing. So I think a good, if you're doing it every day, then I think a good strategy is before going to bed and then waking up in the morning, use heat, because your tissues are probably going to be sore. They're probably going to be stiff. They're probably going to be tight and have some tonality to the muscles that needs to be relaxed and needs to be worked out and stretched. And the nervous system needs to be a little bit subdued. So before going to bed, when you're first waking up, heat's probably a pretty good idea to incorporate. As far as the ice, particularly if you've gone to the wellness gym or you've done a lot of walking or something immediately after, then you may want to use ice to help, one, reduce any inflammation that may occur, but also, again, locally reduce any swelling, numb the tissues a little bit, so it makes it a little bit easier. So use ice a little bit after immediate exercise and activity versus heat. And you can use a combination. Like I said, you can use before and after bed, use the heat. During the day, after you've been moving, walking, doing stuff, use the ice. Um, Something else that needs to be talked about is heat and ice with wounds. And we talked a little bit about it post-surgical. You never, ever, ever want to use any kind of heat. Even though it may feel good, you're at risk for making a wound worse by cultivating bacteria through the heat, by increasing swelling, and you can even damage the tissues if you're not careful enough by using heat. So you really never want to use heat with an open wound or a chronic wound or right after surgery. You want to use ice. So some homemade ideas for cold. You could think about wetting a washcloth or a towel and sticking in the freezer. Allowing that to, for a little bit, you don't have to stick it in overnight, but for, 30 minutes or so, let it get good and cold, and then you can apply it to your skin. And you can use a wet sponge or something that can hold a little bit of fluid, that then you can put that fluid in the freezer or the refrigerator and allow it to get cold, and then apply it locally to the area. As I mentioned earlier, peas, a bag of peas, even a bag of rice can retain some cold, and then it can be used locally to your back. Or you can buy specifically made from the store gel packs or anything of that nature that are designed to go in the freezer, and they have a little bit of fluidity to them. So then you can apply it and it can conform well to your body. You really don't need anything special or fancy. CVS, Walgreens, any of these department stores like Walmart, Target, they should have a gel pack, ice pack, something that, one, is big enough to support the area, but two, can go in the freezer or the refrigerator and retain that cold. I would say a good size would be the size of roughly a sheet of paper. It doesn't have to be quite that big, but especially if you're applying it to your back, you want it to be big enough to cover the area, because the muscles in the back are large and they need to be disperse the energy of the heat or the cold to that area enough. If you've got too small of a gel pack or something you're trying to freeze, it may not be adequate enough to do its job. So as far as the heat goes, again, they make specific heating pads that you can buy at the store. You can put them in the microwave. They usually have specific instructions as far as do for this long, or do for this long. So always look at the instructions. You can also do the same that you did with the cold, is you can wet a towel or a washcloth, but then you can put that in the microwave. Just have to be careful about doing too long and burning yourself. So probably about a minute, anywhere from a minute to a minute and a half would be a good time. But again, always check before you're applying it that it's not too hot and you're not giving yourself a surface burn by applying it. And again, they have store-bought packs you can get, like a heating blanket, and roll it up or fold it up and apply it to your back. But both heat and ice are good, and both have their own individual reasons and applications. When you're applying it to your back, hopefully you can see my screen here. The reason I've chosen this picture, I just Google imaged spine, but I want you to appreciate the curves of the spine. And most people have typically low back pain. Some people have pain higher up, and you can always apply there. But you really want to make sure that when whatever you're applying, it's supporting your curve of your back enough, so that one, your spine is not flexed or is not in a weird position, but two, it can appropriately target the muscles running along the back to do its job. So just be conscious. Just know that as you get lower, you might want to support it up and put it a little bit lower. And a good way to visualize this would be to feel for your hip bones, the the bony parts of your hips on the side, and then apply approximately in the same area. But you can always apply directly to where the pain is coming from. Again, just be conscious about putting a layer in between when you do apply, and just be sure that you don't burn yourself. So again, this is not supposed to be a specific guidelines, do one all, do all, but it's supposed to be just general information about heat and cold and their applications to the back. You can apply both. You just want to be conscious if you do have any swelling or a wound or any kind of local inflammation or an infection, you really don't want to use any heat because you may make your situation and your medical status worse. You can always apply ice, just be careful that you're not applying something that's too cold and applying it for too long, because you could have the opposite effect. So really a good rule of thumb is about 10 to 15 minutes maximum. Just be careful, make sure you've got a layer in between your skin and whatever you're applying. And then just remember, you want to reduce swelling, but you can apply both. You can apply heat before you go to bed and when you first get up in the morning, and then apply ice after you've done some activity, or you've been up walking, or you've been to the wellness gym or something more vigorous. You may want to apply ice to reduce some of that pain response and muscle swelling. That's all. I hope you enjoyed this lecture. And again, this is back care and maintenance talk, specifically about heat and ice. And again, my name is George Wanamaker, and this is the continuing series. Thanks.